Well, good afternoon, everybody. Hard to believe a week has already gone by, but it has. And it is time today for the Chronic Pain Education Series from the Global Pain Association. My name is Ron Aaron Eisenberg. I am your host for today and your moderator for what should be a fascinating discussion about acupuncture. Raise your hand. How many of you have ever had acupuncture to treat pain or other conditions? Well, we're going to hear from an expert today. The role of acupuncture in chronic pain. Scot Taylor is going to join us, and this program is presented by the non-profit organization Global Pain Association. Today's program brought to you by Advanced Spine and Pain Center. They're fellowship-trained physicians specialized in treating acute and chronic pain conditions. Advanced Spine and Pain Center offers on-site pain management with advanced non-opiate procedures and multidisciplinary treatment plans. Their locations in town, Texas Center for Athletes in Westover Hills, and Stone Oak. You can check them out on their website at www.advancedpaindoc.com. And at the beginning of every program, we are so pleased to welcome Dr. Susan Blackwood. Susan had the idea to put together what has become a worldwide venture, the Global Pain Association, targeting those who struggle with chronic pain, and they are indeed worldwide, people who wake up every single day in pain and are looking for answers. Susan, great to see you.
Great to see you, Ron, and thank you so much for moderating this each week. You do an excellent job of bringing our Global Pain Association followers to so many great topics, and we couldn't thank the Eisenberg Group enough, and also the people at Advanced Spine and Pain for sponsoring this segment. Our board voted a few weeks ago to run the series through the rest of the summer, every Saturday morning, live on Facebook. And we've had such great responses from people that have been watching this and learning from these resources and these experts in the community. So we can't thank you enough. And people want to send in more topics for future segments. They can do that at info@globalpain.org. And we'd love to hear from them.
And the other thing they can do, as Gloria Garza Vasquez has already done, you can share this with others so that you can tag your friends, send it out, and get other people to join in who may not be aware of it as yet. And Gloria, we thank you for that. Susan, tell us, the concept here was to provide hope and help for people with chronic pain. Who are the members of the association?
Well, actually, it's anybody that wants to look on our website, come to these virtual series, attend some of the segments that we've had in person last year. All these supporters and caregivers and people with chronic pain are part of our community. And it's all free. It's accessible to anybody. And we're just really pleased about all the 22,000 people that have been watching it online.
Have you ever had acupuncture?
I have not, but I'm really interested in today's segment.
Now, I know you mentioned off air you were a little queasy about needles, but with acupuncture, we're going to find out in just a moment from Scot, you don't even feel them. They are so tiny. So stay tuned, Susan. Take notes. We'll get you back.
Okay, and I've taken a tour of Scott's laboratory. It's amazing. So I'm looking forward to this.
Oh, cool. Well, thank you very much. Scot Taylor, who is our acupuncturist today, is the founder and clinical director of Balance Acupuncture Natural Medicine in San Antonio. He graduated with a Master of Science in Acupuncture and Oriental Medicine from the Academy of Oriental Medicine in Austin in 2000. His specialization is pain management, women's health, and fertility. He's got extensive postgraduate training in multiple modern and classical acupuncture techniques. He's a fellow of the American Board of Oriental Reproductive Medicine. Hey, Scot Taylor, great to see you. Thanks for coming on.
Good morning, Ron. Thanks for having me. I'm happy to be here.
How did you get involved in acupuncture?
Doesn't every red-blooded American male grow up wanting to be an acupuncturist, Ron?
Stick needles in people, absolutely.
It's a long, convoluted story, so I won't go too deep into it. But basically, my uncle, when I was growing up, he lived overseas and he was a bit of a world traveler. He especially loved to go to the Asian countries, in India, China, and was a bit of a searcher. And he would always come back and stay with us for a couple of weeks every couple of years. And he would tell me about his adventures over there, about the Chinese culture, language, philosophies, those sorts of things. And I just became very intrigued. So when I was a young man, like in my late teens, early 20s, I became really interested in Eastern philosophy, especially Taoism, which is a natural philosophy just about man's place within nature and how to live in harmony according to the rules of nature. So I became very intrigued with that. I always wanted to do something in the healthcare field. So in my undergraduate, I studied biology and psychology. But by the time I finished college, I was too busy having fun playing music with my friends to want to go to work. So I went off and played music for about 10 years. And when I was winding that down, I was living in Austin. I had a shoulder injury that I went to a local school, a Chinese medicine school, and had a couple of treatments on that and had a really good response, and found out a little bit more about Chinese medicine, that it was based on the philosophies of Taoism, which is, again, about living in harmony with nature. And that's, the rest is history. Yep.
So give us the 411 on acupuncture. It's the kind of thing, everybody knows everything about it, but we know nothing about it.
Right. Yeah, it is basically just, as most people think, it's the insertion of very fine, sterilized, single-use, disposable needles into specific points on the body in order to trigger a healing response. Basically, everything that your body uses to heal when it comes to Chinese medicine treatment is endogenous. It's within you. The acupuncture and any other adjunctive treatments that we use, like Chinese herbal medicine, moxibustion, cupping, they're just a catalyst. They're a catalyst for bringing forth your body's own natural and innate ability to heal.
And what is the treatment like? In fact, I think you have a sample of one of the needles with you to give us a sense of when you say small, we're talking.
I do.
Small.
Yeah, actually, if Gina could bring up that first slide, we'll talk about that first. So this is actually a picture of somebody doing an acupuncture treatment. So the part of the needle that you see her gripping is actually the handle. That's like a spring wound part of the needle that allows us to get a good grip. But the part that's inserted into the skin is very, very thin. As you can see, it's just maybe a little bit thicker than a hair. I always say a little thicker than a hair, or a little thinner than a cat's whisker. And we use a tube to tap them in. So if you'll bring me back up, Gina. I'll show you. I actually have one here. They come in, like I said, sealed, sterilized blister packs. They come with a little tube, which is this part here, and then the needle itself. I don't know if you can even see that. It's so thin.
Wow.
So we put them in the tube, and then the needle just sticks out a couple of millimeters beyond the tube. And let's see if I can find the camera. Here we go. You just tap. That's it.
And there it is. And you don't feel it.
There is a little bit of sensation. You want to feel a little bit of sensation. We are activating the nervous system. So feeling a little heaviness, a little achiness, a little tingling, a mild electrical sensation is actually beneficial. It lets us know that the signal is there, right?
And is there bleeding?
What's that?
Is there bleeding associated?
Almost never. If you look at the needles under a microscope, they're actually not even pointed on the end. They're rounded. And these days they're laser sharpened. So they're they're just so thin that they go through the skin, and they'll typically, if they run into a capillary or a blood vessel, they'll typically just kind of nudge it out of the way. So very rarely there might be a drop or two, but it's very, very rare.
So Scot Taylor, talk us through how acupuncture can help folks, especially those with chronic pain, because we know, watching us today and around the world, people woke up with pain. Millions of people struggling with intractable pain that doesn't go away. How can acupuncture help?
Absolutely. Yeah, I think acupuncture can be a really, really important part of people's health maintenance and an integral part of their pain management system. So before I start talking about the actual mechanisms that acupuncture works by, let me just do a brief overview of the physiology of the experience of pain.
Sure.
So when you feel pain, there's three parts to that equation. The first one is a sensory part, right? What does this feel like? The second one is an emotional piece. So what does this make me feel? And the third is a cognitive piece. So basically, what does this mean for me in my life? So basically, when you feel pain, your brain is kind of scanning through the database and looking for similar experiences that match that experience of pain. So, for example, let's say that you're walking through the woods and all of a sudden you feel a sharp stabbing pain in your ankle. So basically you feel that pain almost instantaneously. In fact, the reflex of drawing your leg away from the pain happens before the pain signal even gets to your brain. That happens at the spine. But then that pain signal travels up into the brain to the emotional piece, right? So what is this pain making me feel? And usually in the short term, it's going to be either fear or anger, right? Because basically what's happened is you've activated the sympathetic, the fight or flight branch of the nervous system, right? So whatever it is that's causing the pain, you're either going to fight it off or you're going to run away from it. And then once it's hit those emotional centers of the brain, it actually hits the more cognitive areas of the brain. Like I said, where you're kind of scanning and looking for where your experiences matches this kind of pain. So you're walking through the woods, you feel this sharp stabbing pain in your ankle, you withdraw your leg, and you look down and you see that it's a thorn. So, okay, no big deal. It's going to hurt for a few minutes. It might hurt for a few hours, but everything's okay, right? So you relax, you go back to a more parasympathetic rest and rejuvenate type of state. But if you look down and it's a hornet's nest, right, you're going to have an entirely different response.
Yeah, I'll bet.
All of these things that you know about hornets, right? And so maybe you have an allergy to a hornet sting, so you know that your life is going to be in danger. Or maybe it's a whole nest of hornets, so you know that if you get stung enough times, even people that don't have an allergy can be very injurious to them. So you run screaming in the other direction. So that's basically how pain works in the natural world. And in chronic pain, what's going on is the nerve is being irritated somewhere and somehow, right? So someone with, say, a degenerative disc issue in their low back, they don't have the padding between the vertebrae, so the pressure of the vertebrae are pushing on the nerve and causing inflammation in the nerve and triggering this pain response. Or someone that has osteoarthritis of the knee, they're missing the cartilage in that joint, so they've got what doctors describe as bone on bone in the knee. So that's applying pressure and inflammation and swelling to the nerve, which is causing that stimulus. But it still goes through these emotional areas of the brain and through these cognitive areas of the brain, right? So you're feeling this pain, it's triggering feelings of anxiety, feelings of irritation, feelings of depression, of all sorts of different things. So if you would bring up the first slide, that's one of the reasons. Slide number 2, Gina. That's one of the reasons why acupuncture is so incredibly effective for pain, is because it can affect a lot of those different pieces of that pain puzzle. So acupuncture basically works through 2 different mechanisms. One we call local mechanisms, which basically we're putting the needle into the affected tissue and we're trying to get a response there locally where the problem is. So it relaxes muscles that are too tight, that might be putting pressure on a nerve and triggering a pain response. It reawakens muscles that have become inhibited or basically turned off. One of the things that accompanies pain is weakness. And the reason why that happens is your body basically just wants you to rest. It doesn't want you to use that limb to where you might, further injure the area. So weakness comes along with pain. I'm sure all chronic pain sufferers understand that. And the reason why is because these muscles become inhibited in order to kind of force you into relaxation. So acupuncture can help to reawaken those and rebalance the function of various joints throughout the body. It decreases inflammation and promotes healing within the local tissues. Essentially, when we insert a needle, we are creating a little micro trauma, and that triggers a healing response. All sorts of biochemicals are released in response to that little microscopic injury, and basically reawakens the body's healing faculties in that area.
Well, Scott, how do you know where the pain is originating from? Because I've often heard the term referred pain. It may hurt here, but that's not really where it hurts.
Absolutely. Yeah, we see that often. And a lot of that we arrive at through our examinations. So when someone comes in, we, of course, we want to get a very detailed accounting of what their experience of the pain has been. We want to know, where are you feeling it? When did this first occur? How long has it been going on? What makes it better? What makes it worse, right? So we really want to dig into what their subjective experience of the pain is. But then also we rely on touch a lot. We palpate the area. We do a physical examination, some sort of manual muscle testing, things like an orthopedist would do. Watching the patient, observing the patient, how are they walking, that sort of thing.
And for the patient, him or herself, how quickly should they experience relief? Is it, everyone wants the instantaneous, wow, one needle, I'm done.
Yeah.
What's the time period usually? And I'm sure
I
you've
would-
heard that, right?
Yeah, I sometimes wish it worked like that, and sometimes it does. But those cases are definitely the exception rather than the rule. Like if you sleep, like let's say you slept wrong last night and you come in and you get a crick in your neck. Yeah, absolutely. One treatment is probably going to do the job. And often people, when they get up off the table, they're 50 to 75% better with that sort of thing, right? But that's a very acute. Basically, the muscle's just in spasm. That's all there is to it. But the longer something's been going on, the more of a structural component there is, the more chronic it is, the more inflammation there is in the area, and the more systemic that the problem is. Like, let's say, pain that's coming from an autoimmune illness rather than just some tightness in some muscle groups is going to take longer. I'd say on average, we see patients between 8 and 15 visits as an initial series. And then by then, they usually have gotten sort of the maximum correction that we can get. And then we talk about whether or not like maintenance would be appropriate for them. A lot of people that have chronic pain, there's a reason that they have chronic pain. There can be some lifestyle considerations, ways that they sit, ways that they work, positions that they're in when they do their hobbies, those sorts of things. And of course, incorporating therapies like yoga, physical therapy, stretching regimens, those all help to lengthen the time between treatments and solidify the results.
No, I know not too many years ago, there weren't many PCPs who would refer a patient for acupuncture. In fact, you told the story of knowing of doctors. If a patient said, I'm going for acupuncture, the doctor would fire the patient.
Yeah.
That changed,
Yeah.
right?
Yeah, I saw that. I've been in practice for 20 years, so this has not happened in a while. In fact, I have several patients currently that are medical doctors, pharmacists, PAs, nurse practitioners. But early in my career, I had a couple of occasions where a medical doctor told the patient, if you're going to keep seeing that quack, then then you find yourself another doctor.
Wow.
Yeah.
Times change.
Times
And
change.
you all now are, you're seen as a regular part of the arsenal of treating chronic pain. If your doctor doesn't recommend acupuncture, is it something the patient should bring up? And how do we find the Scot Taylor?
Yeah, absolutely. It's definitely, my experience is that has been in the last 10 to 20 years, people's minds are being opened across the board, not just patients. I mean, patients, a lot of times they've had friends or family members that have had great experiences with acupuncture, and so they want to try it. But medical doctors keep getting these reports from their patients too, and the research has increased exponentially in the last 10 to 20 years. In fact, I did a search on PubMed the other day because I was just kind of looking to see what sort of new research had come out. And there were about 33,000 research articles that were on PubMed in regards to acupuncture.
Wow.
Almost 25,000 of those were within the last 20 years. So people, it's been around for 2,500 years. It's things don't typically stick around for that long if they don't work, right? So people are seeing that there is some validity to it. Even insurance companies are now starting to be more accepting. It's still, I'd say, maybe only 20 to 25% of our patients have insurance coverage, but we are starting to see it, especially for things like low back pain and neck pain, where there's an abundant amount of evidence that it is very efficacious and helpful.
Why do most people come to you?
I would say that pain is the number one reason. Acupuncture doesn't just work with pain. I mean, it is, like I said, the whole idea is that it helps to trigger your body's ability to heal and to regulate its own function. So really, it can be helpful in a lot of situations. We do treat a lot of hormonal issues. Women's health and fertility is a specialty that we have, so that is something we see a lot of. But pain is by far the number one thing that we treat. Low back pain, neck pain, I would say would be the top two.
And for folks who are going to see someone for acupuncture, I know you deal as well with the immune system. And how does that function?
Well, acupuncture, like I said, it has sort of a regulating effect on these different feedback systems within the body, right? So your immune system is a feedback loop, just like your endocrine system is a feedback loop between certain glands and the brain. And I always describe it as if it's like hitting the reset switch. So if you've ever had a computer open for too long and you've got too many pieces of software running in the background, too many pages open on the web browser, things start to get kind of gummed up and slow down. And really acupuncture, when it comes to this sort of endocrine function, it seems like it's like hitting the reset button.
I think slide number 4 deals.
Yes, sir. Yeah, if you pull up slide number 3 and 4, both talk a little bit about the endocrine system and the immune system.
From your standpoint, you've got a career that obviously you enjoy. Would you recommend it to others who are thinking about a medical career?
Yeah, absolutely. Absolutely. I think that it's an up and coming vocation, and it is a vocation. It's something that, takes a lot of dedication. It's not easy for Westerners to learn because it is such a foreign way of looking. When we look at not this modern research that we've been talking about, but the traditional theory, which is what you have to learn to really practice it, it's very foreign to the Western mind, and it takes a lot of dedication to want to do it. But if it's something that really lights you up, it's a wonderful way to be able to help people. I get the experience every day of feeling like I've been able to help make people's lives a little bit better.
Well, I want to thank you so much for coming on. Is there anything we haven't covered that you would like to talk about before we have to say goodbye to you?
Well, I do just want to say that, for all of you that are watching, if you have not had the opportunity to try acupuncture or any of these other alternative and complementary, I think really complementary is a better word than alternative, therapies that we've been talking about on this whole web series, I think would be really wonderful if you would give them a chance. It's not like taking a pharmaceutical or having a surgical procedure where these things work in isolation. A combination of physical therapies like acupuncture, traditional PT, yoga, in combination with mindfulness techniques, meditation, acupuncture, and when necessary, pharmaceutical and surgical interventions. I mean, we're very blessed to live in a time where we have all of these options available to us. If you don't know an acupuncturist in your area, ask your friends and family. There are some online resources where we are licensed by a national accreditation commission. It's the NCCAOM, and they're at nccaom.org. You can find accredited people there. At least in Texas, we're licensed by the Texas State Medical Board. So if you don't know of anybody in your area, you can go to those resources to find someone that at least have the minimum accreditations.
Now, to be licensed, do you take a licensing exam?
Yes, sir. We have a master's degree. The baseline of entry is a master's program, although there is a doctorate that's available now. And then we take a national accreditation exam, and then we are licensed by the Texas State Medical Board.
Well, Scot Taylor with Balance Acupuncture and Natural Medicine of San Antonio, we thank you very much for coming on. Do you have a phone number you can give us for folks who might want to call?
Yes, sir. It's 210-479-3900. And we are always open. We know we're very, very much aware that the majority of people have not had acupuncture. I think the last research I read showed that less than 10% of Americans had tried acupuncture. So we're very open to just making contact with people. If you want to talk about what's going on and whether or not we might be able to help, then just reach out to us. We'll get you scheduled for a free 15-minute consultation. We'll just give you a call and you can tell us what's going on and we'll tell you about whether or not we think we might be able to help.
Give us that number again.
It is 210-479-3900.
Scot Taylor, thank you. We really appreciate your time.
Thank you, Ron. I appreciate it.
Bye-bye.
Bye-bye. Have a good weekend.
We'd like to thank our sponsor for this week's program, Advanced Spine and Pain Center. They're fellowship-trained physicians specialized in treating acute and chronic pain conditions. Advanced Pain and Spine Center offers on-site pain management with advanced non-opiate procedures and multidisciplinary treatment plans. They're located in town, Texas Center for Athletes, Westover Hills, and Stone Oak. Go to their website, www.advancedpaindoc.com, advancedpaindoc.com, for information about them and their services. And now it's time to bring Susan Blackwood back. She has been busily experimenting with needles in her own home, and we'll see how that's been working out. Susan is the founder of the Global Pain Association, began this program with a slight fear of needles. Have you gotten over that in any way, Susan?
I thought that was an amazing presentation, and I've seen some people on our chat line say that you can't feel a thing. So I'm looking forward to having a conversation with Scott about this in the future. But again, I want to thank the Eisenberg Group for all you've been doing and bringing the series to folks at home. 22,000 of them now have been exposed to our virtual series, and we can't thank our sponsors enough. But in order to be able to make sure that the series goes on, we're going to need more not-for-profit donations. And people can do that by going to our website, globalpain.org. Look at the Get Involved tab and make a donation. And it's all tax deductible because we're a 501c3.
And there are opportunities for sponsorships. What about ideas for topics for programs? Are you looking for those too?
We are. Now we have the series pretty much scheduled for the month of the rest of it, this month, July, and all of August. But we're hoping with the interest that people have shown that we'll be able to continue it in some way.
That's perfect. Susan Blackwood, thank you very much. I want to remind folks who may be watching that coming up next Saturday, July 25th at noon, right here on the Global Pain Association Facebook page, Spinal Cord Stimulators for Pain by our friend Dr. Ellen Lynn. That continues right after, in fact, certainly segues with acupuncture. Spinal Cord Stimulators for Pain with Dr. Ellen Lynn. And again, if you want to get involved in the Global Pain Association, info@globalpain.org, info@globalpain.org. And thanks to all of you who are making comments. We really appreciate that. Lisa Payne, thank you for sharing this. And we appreciate all of you who are taking a look. Let your folks know about this opportunity every Saturday at noon. The Global Pain Association brings you our special focus on an element of pain and a way in which it can be addressed. On behalf of the Global Pain Association, I'm Ron Aaron Eisenberg. We'll talk with you again next Saturday right here on the Global Pain Association Facebook page. Have a COVID-free weekend, everybody. Bye-bye.